Perfect. I got it. All right. So, pros and cons of working in the clinic as a LPN. Okay. So, the number one pro I can say that you can attain through working in the clinic as an LPN or a nurse or as an RN is the hours. So, I really enjoyed working the hours when I worked in the clinic as an LPN because I could work Monday through Friday, 9 to 5, and then go home. And then I know some nurses are used to working 12 hours. I used to work 12 hours when I worked in the skilled nursing facility back in Texas. And I can understand why someone would like 12 hours because, like, every other weekend you have off and it's only 3 days, and then the other week 4 days. So you have a long stretch of days off. But when you think about it, when you are doing those long stretches of days off, like, sometimes you can still be tired. All right, so if you guys comment, I'm not ignoring you. I just wanted to get the pros and cons out the way, and then I will take and then I will read your comments and chat with you guys. Okay, but that's the number one reason why I really liked the clinic, because I'm a Monday through Friday girl. I like working 9 to 5 because I know I get to go home, and I know I have every weekend off. So if you're someone who, of course, right now with the health situation that's going on right now, going to public events such as birthday parties and bridal showers and weddings are quite a challenge. But of course, when the world goes back to normal, if you want to have somewhat of an outside life, if that's really important to you, the 9 to 5 schedule can be very appealing because of that. And even after that, you can go to school afterwards if you have night school. There's an array of benefits you can attain through working the 9 to 5 schedule as a nurse working in the clinic. Okay, so the next pro I can say is that it kind of reminds me of secretary meets nursing. So if you ever did secretarial work, then working in the clinic as a nurse can be something that you would really like, because a lot of times you do paperwork, like kind of desk work stuff. That's not all you do, but I remember when I was working in a clinic as an LPN, I worked in a family clinic. There were times when I did like something called tele encounters, and it required me to sit at a desk and handle patient situations with their different insurance providers and communicate with different doctors and various people in the healthcare team. So it required me to use my desk work clinical skills, and sometimes I would have to like file papers or call people to remind them of their appointment or confirm an appointment. So that's another reason why I really liked working in the clinic, because I didn't always have to be on my feet 24/7, as opposed to when you're working in a hospital or nursing home. A lot of times you are on your feet. Okay, and that brings me to, hey, Melanin Mama 22, how are you? So that gives me another pro. Another pro is that you don't have to have 40 patients to give medications to, and you don't have like huge wound treatments to give to. So you guys know when you're working in a nursing home, you usually have 40 patients to give medications to. But when you're working in the clinic, you don't have to worry about giving 40 people medications to. And I don't really give medication at all in the clinic. I just administer vaccine. That's the most amount of medication that I would administer as a nurse. You just triage the patient. Triaging meaning bringing them into the room, taking their blood pressure, their vital signs, taking their family history, their surgical history, their medication history, and you're just basically compiling a list of information for the provider to use to help the provider make a diagnosis, or point them to the right direction that will be best for their care. And you don't have to worry about doing any huge wound treatments. Like, usually if the patient has a treatment, or like a bandage or something, the doctor would look at it. It's not really things of that nature. Okay, Another thing is you won't have to worry about admissions. When you're working in the clinic, you don't ever have to worry about admitting a patient. So say goodbye to that long, extensive list of, if you ever saw my video, I have a video on my YouTube channel talking about how to admit a patient into a long-term care facility. It is an extremely extensive process. It takes forever. So you don't have to worry about completing your Braden scales and watching patients for falls. Like, I don't know, when I used to work in a skilled nursing facility, I would always walk down the hall and make sure that no one is off the bed on the floor. You don't have to worry about patients falling. I mean, patients can technically fall, but it won't be so much as like, oh, you weren't doing your job or whatever, because outpatient is different. Outpatient, people come in and they go out. So it's not so much of a, oh my God, I have to watch this patient for falling, watch this patient for falling. It's not like that. And you don't have to worry about admitting the patient because it's outpatient. They come in, they come out. It's really quick, all right? So I would say that if you're an LPN who has worked in a nursing home or an RN, if the level of difficulty in terms of work in a nursing home is at a 10, then working in a clinic will be at a 1 to you. I'm not saying you don't have days where it's very difficult. I'm not saying aren't days where you could be stressed out. But honestly, if you could work in a nursing home, I feel like you could pretty much work anywhere. But working in a clinic is nowhere as near difficult than as working in a nursing home, to be honest with you, okay? So it can be busy. There are times when it can be extremely busy. There's a lot of patients to be seen. There could be up to like 55 patients to see the doctor in one day, and you have to get those patients in and out, in and out. And sometimes maybe somebody called out. So it could be very busy, but it's not like back-breaking, like, soul crushing work. It's not like that at all. Like, for the most part, a lot of the patients treat you with respect, and depending on where you work, the doctors are really nice. So I was fortunate enough to work in a clinic that the doctors were extremely nice, were extremely helpful, and they were extremely receptive to, teaching me about the ropes and about medicine in general. So I was extremely grateful for that opportunity. Okay. So yeah, so I got to give vaccinations to an array amount of patients across the lifespan. I'm talking about newborn babies. So that was something I really, really loved. I got to give vaccines to newborn babies. I'm talking about days old. So I really loved that. I got to measure the babies, like take off, you have to take off all their clothes and put them on the scale and measure their height. And I love that because I absolutely adore babies. I got to hold them, and like you guys know, I don't have any children. I don't know anyone personally who has any children. So I absolutely love this. So that's what I wanted to say. Don't ever shy away from an opportunity, because at first I was very scared because I was like, oh my God, I never dealt with like a newborn before. I never gave like a vaccine to a newborn. But don't ever shy away from it, because even with 7 years experience, like I didn't have that pediatric, like I had pediatric experience, but not to that capacity like newborn. But don't ever shy away from it. Don't say, oh, you're an LPN. No. Do your research, know what you're doing. And yeah, so we got 10 people watching. Can I get 10 likes, please? Please. All right, so that's what I really liked about it, okay? Another thing is I got to learn how to draw blood for the first time, okay? I did not know how to draw blood. I know you guys are like, what? You've been a nurse for... Yes, it is possible for a nurse that not have certain skills. It depends on the setting that she works, okay? So I got to learn how to draw blood at the same time. I'm not going to say I'm a pro, but I'm pretty confident in my skills at drawing blood now. And I got to learn how to do EKG, okay? So I know you guys are probably like, what? You don't know how to do EKG? Yes, I am very aware that medical assistants know how to draw blood and EKG. And sometimes when a nurse comes onto the floor and they don't know that, they look at you like you have 5 heads. But it's like, that's not how nursing works. Like, nursing is basically, if you don't use it, you lose it. So that is why a lot of people, when you apply certain jobs, they ask you, do you have experience in that department? No, I did not know how to draw blood. No, I did not know how to do EKG. I never assess the newborn or whatever before as an LPN, and I learned all of that at this clinic, so I am extremely grateful for that, okay? So don't shy away from it. Just know what you're doing, do your research, and go for it, all right? Another thing another pro I like about working in a clinic is when you first arrive on the floor, you have plenty of time to sit down and relax and see what patients, how many patients your provider is going to see today. I know I was the only LPN working, and we had like, I think maybe 3 or 4 other MAs, medical assistants, and I got to see like, okay, we're going to have this many patients coming in today. Or sometimes I would just do telephone encounters, and I would be with the doctor in the doctor's office, like just dealing with that, like how many people are asking for this. So telephone encounters, if you guys want to know what that is, telephone encounters, like someone could say, hey, I need a refill on this medication, or hey, my medication was not approved by my insurance, and it's basically my job to figure out like what to do, you know what I mean? So okay, let me look at the comments real quick because I don't want to completely. Janelle White says, I love your videos. I do have a random question. Have you taken the ATI predictor exam? If you do, you have any tips for studying? ATI predictor exam. Oh no, I have not taken that exam. I'm sorry. I used ATI to study for my LPN, but my school actually uses Kaplan for my RN. All right, Melanie Mama just got back home from Brooklyn. Hey girl, I'm in Brooklyn too. She says she's still waiting for her ATT. Okay, be patient in God's timing. Rosaline says, I want to work in a clinic as well. Yes, I love working in a clinic, and I definitely promote working in a clinic. It's totally awesome. Okay. Rosaline says, I'm starting to hate bedside nursing, and some of my patients, when I hear they die after. Yeah, it's really like bedside nursing can be extremely stressful. It could be extremely taxing on the body, but the good thing about it is that sometimes, a lot of times, bedside nursing has like if you're like really, like if you're wanting to make good money, a lot of times bedside nursing has good money. And also in bedside nursing, it could have a lot of good benefits. Like that's one thing I didn't like about where the clinic I worked. It could be completely different for you, but they did not offer health insurance, so that's something I didn't like. But the clinic I worked in paid extremely well, so that is definitely a pro. Okay, so that is definitely a pro. I respect your honesty. Thank you. Oh, Simone Erie says, I had no idea how to do EKGs when I worked in the clinic, so the MA had to show me how to. Yeah, that's the same thing that happened to me. I did not know how to do EKG in the beginning, and sometimes, you know, sometimes people look at you weird, like, what the hell, but that's just people who do not understand the field of nursing. Just because you're a nurse, a registered nurse, whatever, even nurse practitioner, doesn't mean necessarily know like everything. Like it just depends on where you work, all right? So another thing I absolutely loved about working in a clinic is I got to work with really good student doctors as well. So one of the doctors that I worked with at the clinic, he had student doctors with him that he got to teach. So a lot of times I got to listen in on like some of the things that the doctor was saying, like just because in passing, or maybe because I was doing something on the computer, I was working. And I got to network with a lot of those student doctors and like figure out what's going on. Even though I don't want to be a doctor, it doesn't matter. And a lot of times you're going to learn is that when you're working, you always want to not say that you are best friends with everybody, but you always want to do your best to network with various healthcare workers, whether they are doctors, nurses, dental assistants, whatever. You always want to network. Even we had a dental side, and I even went over there sometimes to say hi, how are you doing? Because you never know who people are, and it's just always good to keep a good rapport within different people working in your healthcare setting. So I definitely love that. But it was very interesting, okay? So another thing is that it's very fulfilling. So if you're someone who's an extrovert like I am, You love to talk to people. You're a social butterfly. It's an amazing thing. I mean, sometimes you get, you know, like there are so many different types of personalities in the world. You're not gonna get along with everybody, but I absolutely love like seeing different patients come in at different times, and I just love speaking to people and communicating. So if you're a social butterfly, you're absolutely gonna love this job because people come in and come out, and usually they're cognizant enough and they have good cognitive function to like carry out a conversation with you, versus if you work in a hospital or nursing home, you don't always inquire patients who are able to speak with you because of their disease processes or their cognitive function. So that's something to keep in mind. A lot of things is it's a fast paced, it's fast paced. I love that it was fast paced, so you're always on your feet. So I lost a lot of weight working in the clinic, to be honest with you, because I was always on my feet. I was always walking back and forth, like triage this person here. Okay, now I gotta take this person's blood here. I gotta do this. I gotta do that. Okay, do this, and then like you're always on your feet, you're always walking, but it's not like I can't like it's not like back breaking work. Like, you know, nursing home, when you work in nursing home, you're staying there popping meds. It's not like you're standing in one place. Like it's like you're always walking, always on your feet. I mean, you could always get tired, but it's like a good kind of tired. Like, I don't know how to explain it. It's not like it's not so urgent, like emergency room urgent. Like, honestly, I'm not saying I would never work in an emergency room, but I do not see myself working in an emergency room. I just like, oh my God. If you work in an emergency room, comment down below. I don't really see myself doing that. I feel like that would be so scary. But you never know. But I love the fast pace in and out. And yeah, so like I said, I got to work with different insurances, so I got a lot of non-clinical work experience as well as the clinical work experience. Okay, so let me see what the comment says before I go to my cons. My cons are not long at all. Simone Erie says, the patients get to know you and just stop by to say hello. Yes, sometimes with gifts, flowers, food tickets for shows. Oh wow, that's awesome. Yeah, so yeah, some patients do get to know you, and like that's awesome. Like I said, you never know who people are. I remember I met a girl who was like, you know, we were speaking and she was like, yeah, she's a nurse too, but she doesn't like to tell people she's a nurse, which is, you see, you have to treat everybody with respect. And she was like, yeah, it's like, if ever you want to work in this hospital, let me know. And that, there you go, I already made a connection. It's because I am a very amicable person. I love people in general, and that's just my personality, really. But yeah. Rosaline Black says, at the hospital, what are you referring to? But the cons are sometimes it pays less. Okay, so like I said, the clinic I worked in, I was very fortunate enough to find a clinic that was paying me the exact same thing I was working in a nursing home, and it was up there. But like I said, like I'm in New York, so I got paid pretty up there. So keep that in mind. But sometimes clinics do pay less. Like a lot of times, I remember when I was applying for clinics in Houston, and they pay significantly less than if I was to work in a skilled nursing facility, because they are aware that, you know, you don't work as hard as if you were to work in a nursing home or a hospital. Oh yeah, and the other con was that there were no benefits that I worked in. They told us that you can't take anything from the patients. Oh, Rosaline says they tell us you can't take anything from the patients. Yeah, usually you cannot take gifts and shows, but I think what Simone Erie was referring to is that sometimes patients can be so happy with your service and like your hospitality and how you nurse, basically, that they would offer you like, hey, I have this free blood ratio, I have this, I have that, because they like you so much. If you're super friendly and you treat people with respect and you don't treat people with like they're just another patient or they're just another number, like you will see like people love you. Like I remember when I would go to the clinic, I remember one time this girl, she loved me so much, not just one time, many times. People would say in front of my boss, like, oh my God, I love this girl, she's amazing. And I didn't ask them to do it. I was like, oh, thank you. People say, oh my God, she deserves a raise. because, you know, that's just in my nature. I treat people with respect, you know, and I try to make people smile. That's something I genuinely love to do. I genuinely love to make people laugh and smile, because this world is dark enough, you know, with everything that is going on right now. It's dark, you know, the fact that like so many people are losing their lives right now. So why not put in a sprinkle of sunshine in their day? Okay. Another thing is that depending on where you work, sometimes they can have a tendency to overbook the doctors. So if they overbook the doctors, it can be extremely stressful on the doctor. And you know, if it's extremely stressful on the doctor, it could be stressful on you. Okay. So sometimes if they overbook, you know, people could get very impatient to the point where they would want to walk out and say, you know what, I'm not gonna stay. And you know, that is a liability, you know, because where the insurance already billed, like this, it just opens Pandora's box to, I don't know, to a copious amount of problems that can occur. So that is another con. Like basically they could overbook the doctor. Okay. Another con is office politics. Okay, so if you work in a very small clinic, sometimes there can be, you know, disagreements. There can be just discord between workers, like any other job, you know what I mean? But I feel like with office politics and stuff like that, just do your work, do what you're supposed to do, be friendly with everyone. That's my advice. And if you see someone like doesn't like you or something like that, don't take it personal, because it's impossible for every single person to like you. It's impossible. It's literally impossible. Just be cordial with that person. If you see somebody, like, be cordial. If somebody's outright being extremely rude, you know, you could always report that. But just be cordial with everyone. And because like I said, you never know who people are. I cannot tell you how many times I've worked with someone and then I go to another job and they're the director of that nursing facility or something. Like, just, guys, be very careful. Don't burn any bridges with people. I don't care if the person's a CNA, like, you never know. Like, some people disrespect like people who are below them. Like, some people are like, okay, well, I'm a nurse, so I don't have to respect the CNA. My dear, I've seen it. I've been in nursing for 7 years. I've seen CNA climb all the way up to director of nursing. Be careful who you treat like crap, because you never know where they might end up. Okay, please like the video, guys. So yeah, the final con, I would say, they need you on a strict schedule. So 9 times out of 10, they need you on Monday through Friday, 9 to 5. And sometimes I found myself working later than that. So you don't always get out at 5. Like, sometimes if the doctor is overbooked or there's extra stuff to be done or like labs to fill out, like, you're gonna be stuck there. Okay, so that's why I say, like, keep that in mind. And that brings me to the final point, is that's why I had to leave my previous clinic position, because it just didn't it wasn't cohesive. It didn't go cohesively well with my nursing school schedule. It did not go well at all, and that's why I had to leave that position, because my nursing school schedule was a little bit too strict. Because before, when I joined that clinic, I was on break and I thought I could do it. But unfortunately, like, school just got way too hectic. And yeah, so just keep that in mind. Like, just because it's 9 to 5, there are some days you can leave at 6, 6:30, even 6, 7. It just depends on the clinic. But most of the time you leave like at a decent time. But yeah, guys, so those are the pros and cons. I hope you enjoy them. So right now I'm going to see if anybody has any questions. It doesn't necessarily have to be about the clinic. It could be about anything else. And let's see. Don't forget to give this video a like. Let's see. All right. It said, Melanie Mama says, when I get my license, I'm going to get one for New York too. Hey. Simone Erie says, I worked there as an agency nurse when they hired me on. I negotiated the same rates. Okay. Melanie Mama says, they will get offended if you don't take the gift. Yeah, Melanie Mama 22, they could get offended, but you know, you can just explain to them that, you know, your boss is just not going to allow it. And, you know, if in order for you to keep working there, you know, you kind of have to adhere to the rules, you know? Simone said, they bring things for the whole office. It's not a bribe. LOL. Yeah, sometimes they could bring Dunkin' Donuts. Um, yeah, sometimes they bring donuts. I mean, it depends on where you work. You just have to follow that policy. Okay, cons. Okay, Simone wants to add on a con to the clinic. She says expensive insurance, okay. Having to work 5 days per week, office drama. Yeah, so yeah. Like that's what I'm saying. It just depends on who you are. For me, I don't mind working 5 days a week in a clinic because I feel like it's not as hard as working in a nursing home. I've never worked in a hospital, and that's something I wanted to ask you guys because, you know, you guys know I'm in my LPN to RN bridge, and you know, without giving too much, you know, I'm a good chunk into it. So, you know, I don't know if I'm still deciding if I want to work in a hospital or not because I'm like extremely terrified. I feel like I don't want it to be a repeat of my first year as an LPN, working in long-term care, like basically being thrown to the wolves and like just thrown to the fire and having to figure out everything on my own. I do not want that to happen again. So, like, how do you guys see working in a hospital? Honestly, because you know I'm gonna find out anyway. Let's see. Melanin Mama 22 says, respect your CNAs always. They are your eyes and ears. Of course. Rosin, that's why I say I respect everyone, even if it's the janitor. It doesn't matter who it is. You never know life. I'm telling you. Everyone in the hospital who works is your eyes and ears. Everyone. There are times when even a janitor came to say, hey, your patient doesn't look good. Because your janitors are in there cleaning the rooms. They know. They notice things. So just, you know, I always give that advice. You know, I am appalled when I see certain nurses, or not just nurses, anyone treat people bad, because I'm like, you don't know life, you know? You have no idea. You have no idea who people are, who people could be, who people know. All right? Give this video a thumbs up, guys. All right, so Rosaline says, our lectures told us not to take anything for the patients. Yeah. Definitely not supposed to. The patients would offer us drink, but we had to be like, no, we can't take anything. Simone says school versus real life is different. You'll see. Rosaline says, yes, always go by that because some patients are confused. Hi, Google Me 2318. Melanin Mama 22 says, yes, always go by that. Yeah. And another thing is, like, when you take gifts from people, like, just be careful because some people could be confused, or sometimes if you piss someone off, and let's say you try to take it under the table without anyone knowing, like let's say you piss them off, they could say, well, remember I gave you, there you go. There you kiss your job goodbye. That's why just don't accept anything, because if something goes down and they decide, hey, like they want to throw someone under the bus and it's you, then you could say goodbye to your job, right? But, you know, it's your judgment, you know? Use your discretion. Okay. Melly Mama says yes, because some nurses are very nasty to the CNAs. Yeah, some nurses are, you know. I'm extremely kind to the CNAs, and to medical assistants and everything. Because it's like, life is too hard to be like me. Like, why? Like, what does that do for your life? It doesn't do anything. Saran says, it depends on the hospital, unit, and staff. I've had a positive experience. Oh, so Saran, I think you're alluding to my hospital comment before. Yeah. So thank you for telling me that. You know, I'm still thinking about it. Melanie Mama 22 says, I've been an aide for 20 years. Wow. Respect. Yeah, so, yeah, so like, yeah, so I always encourage people to always be extremely kind to your nursing assistants, your aide, your medical assistant, because in life, let me tell you something, there's no such thing as you being better than someone else. There's no such thing as that, because today you can see someone down here and tomorrow they could be up here. Today you can see somebody up here and then tomorrow they're down here. So on your way up or on your way down in life, you will always pass by the people who were on your journey. And depending on how you treat the person, you can either climb back up if you fell, or you could even climb higher from where you are. Okay, so I think, you know, it takes a very intelligent person to know that. So just respect everyone. I always advocate for respect for everyone in my channel. Whether you're a nurse or CNA, just respect each other, work together, and your shift is going to go that much better. Sorry guys, I have makeup on my nails. Simone says, I worked in an affluent area, so some of the patients like give the whole office gifts, not just one person in particular. Okay. Rosalind Black says, I am a new RN, and when at the hospital, the CNA tried to tell you what to do. Yeah, so sometimes you can find that too. Like me, like sometimes I find that, especially since, you know, I have a baby face, I look very young, and sometimes I get people try to tell me, but you know, I feel like it's important not to make the person feel low or inferior, but at the same time, you have to be assertive and like make it known that you are the nurse. Because if someone tells you, whether it's a nurse or a CNA, as long as they're not like your superior, if someone tells you, hey, do this to do that, sometimes the CNA may tell you something because they've been in the floor before and they know. Like sometimes they may know a little more than you. But if you know, if they're telling you to do something that is unsafe, just know if you go ahead and do it, it will be your license on the line. So, you know, you could kindly decline, say, oh, thank you for your, if you know it's unsafe as a nurse, you could kindly decline, say, you know, thank you so much for your advice, but I feel like I'm going to do it, not I feel, I'm going to do it that way, you know? And like I said, you know, you say it in a very kind way. Some people will still find offense, and in that case, you know, that's their issue that they need to work out, because you worked extremely hard for your license and you got to protect it. But I would say, you know, if they're telling you, I've had that before, because like when you look young, stuff like that, just assess what they're saying. Sometimes a CNA really knows what they're talking about. They say like, hey, like that patient is not going to allow you to do their treatment after this time. This is the only time you could do it. And sometimes they are extremely right. More times than not, they are right. You better do that treatment now. Because, you know, real life is different from school. All right? Especially be kind to everyone, especially housekeeping. Yes. All right. So Melanin Mama 22 says, what are your thoughts on getting a temporary license while I'm waiting to test? Melanin Mama, what temporary license? Like, what do you mean that? The facility that we had, clinicals at, hires new nurses from our school. Yeah, I mean, I don't see anything wrong with that. I heard there are some facilities that hire you and your position at the hospital or the facility is solid. And it's contingent upon you passing your NCLEX eventually. So I would say, yeah, if you feel like that's what you want to do, then definitely do it. But don't forget to focus on NCLEX. That's all I could say, because that's the #1 important thing. And that's a great way to like sort of kind of get in there. But you know, keep your options open. Like, look through everything, because as an RN, especially in this climate, you're gonna have a lot of options available. Rosaline Black says, when I worked night duty as a float nurse and had to give medication, she was telling me to do bed baths. What? Oh my God. You know something? I experienced something similar to that, Rosaline. I remember one time I was working in a travel assignments, and I had a I had a CNA try to tell me to do something of that nature. And you know, it's not to say that I would never like not help someone, because like nursing is nursing, but I feel like if someone's telling you, oh, do bed bath, like, but I'm giving medication, how the hell can I give bed bath and give medication at the same time? And, you know, come to find it, some weeks later, I found out that the person who was telling me to do that, she was actually in the nursing program and she had to drop out because of some family issue or something. And, you know, I'm not saying that's the reason why they asked me to do it. It could not be, but some people bring their issues to you. And, you know, sometimes people can feel some type of way because, you know, they may want to be in your position. But I think the best way to handle that is to like kindly decline, say, you know what, um when I finish my medication, when I finish my work, I can try to help you. Or say, you know, I would love to help you do the bed baths. I'm sorry, do you feel overwhelmed? How can we fix this? Like, how can we better assign work? Because she's probably, maybe she's overworked, you know? So maybe we say, oh, how can we work together to provide the best patient care? Because the main reason why you guys are there is for the patient, right? The main reason why you guys are there to give best patient care. So, you know what I mean? But, you know, you have to try to work together. You never want to create a hostile environment. Be like, don't tell me what to do. Don't tell me to do bed baths, you know? Say, you know, I'm giving medication right now. I cannot help you do the bed baths. I apologize for that. I apologize to the fact that do you feel overwhelmed? Is there something we can do to make your workload a little bit easier? You know, because you want to let her know that, you know, at the end of the day, you are the charge nurse. But if you are having difficulty, let's fix that. Because you don't want to, like, appear as, like, oh, like, you don't care. Because it's, like, being a CNA or being an assistant is not easy. It's extremely hard. And, you know, my heart goes out to them. So anytime I can help, I always help. But if I cannot help, you know, I will be honest. I'll say, I'm sorry, you know, but let us try to figure out how we can better distribute the assignment so that everybody has equal stuff, so that we all able to give the patient care. Okay. Simone Erie says the old school CNAs will not try to boss you around, but listen and stand up for yourself if they are not right. Yeah. Yeah, you definitely do have to stand up for yourself and try to reach a common ground. Melanie Mama 22 says, I've been doing You World. I finished a whole question bank. Wow, congrats. Now I'm just reading through the Saunders book. You go, girl. You definitely gonna pass. Rosalind Black says, I feel like Boo Boo the Fool and spent so long doing one bath on difficult patient. Oh, I'm sorry. Oh my gosh. She said, I told her that I would help her later, but she was like, you could do the medications afterwards. Okay, absolutely not. Like, okay, Rosalind, I feel like in that situation, you should tell the person, okay, this is how I would handle the situation. I would say, I'm sorry if you feel overwhelmed. We have to find a solution and a way to distribute the assignment so that you do not feel overwhelmed. Okay? I would go up to whoever's ahead of you and talk about that. So that say, hey, hey, the CNAs, one of the CNAs have expressed that, you know, she is having difficulty completing all her assignment and she needs help. And I'm giving medications. What can you do? Okay, because like if they need more CNAs there, like that's above your pay grade, you have to report that. And then I would follow up with saying, I will try to solve this issue with you by asking X, Y, and Z supervisor. But I, at this moment, the patient, I am the nurse, and I need to administer the medications the patient's health, because administering the medications is extremely important to provide the best quality of care and to make sure that their health is maintained during these hours, okay? Because patient can have, I mean, you don't have to specify what they're getting because that's HIPAA, but come on, like, she gonna tell you not to give out valporic acid. What if that patient has a seizure? You're gonna tell the patient not to give the blood pressure medication to stop and do a bed bath. What if that patient has a stroke? So do not let, I'm telling you, you need to really go above your whoever's ahead of you and let them know, because I'm not going to stop my medication and not give the medication now. If the patient has a stroke because you didn't give the blood pressure, they're gonna go after you. They're not gonna care. They're gonna say, oh, so you listen to that person? Like, aren't you the nurse? Like, it's your job as a nurse, whether you're LPN or RN, to properly, like, that's what they hire you. It's like, it's under your discretion. You have to know how to manage. Even when you do NCLEX questions, they always ask you, like, how would you manage this? Because if you don't know, like, even if you get the license, you got to follow that. You got to know, like, exactly what's going on. And if you know your stuff, you're able to defend yourself, Like, I'm not going to lose my license over anyone. If somebody feels sad, then I don't know. We have to solve it. We have to solve it. Melanie Mama says, no, always do your meds first. The bath could have waited. Yep. Melanie Mama says she was trying to get you in trouble. Yeah, it's possible. Rosaline Black says, congrats, Mel. Melanie Mama says, thanks. I hope I get my ATT soon so I can take the NCLEX. Aw. Mama says, or SN. Simone Erie says, what? The CNA is bugging. Meds first. Melanin Mama 22 says, can you do another video on NCLEX prep? What do you mean? Like specific stuff? Like specific topics? Melanin Mama 22, I do have a video that I'm going to do about different IV gauge needles and what you should know about it when it comes to NCLEX and nursing school and school in general. So in a sense, that would be a little bit of NCLEX prep. But yeah. But thank you so much for the suggestion. But is that what you're talking about? Maybe that's what you're talking about. But yeah. Oh, okay. Yes, that's a good topic. Yeah. So yeah, so I just filmed that video today, hence the makeup. Oh guys, basically, just a little quick girl talk. I have an extreme amount of difficulty putting on false lashes, especially with the glue. So I've tried the magnetic lashes, like, the double ones, and they have been so difficult for me. But there's these new ones, these Ardell magnetic lashes, and you actually put the eyeliner and then you put on the lash. And I'm not perfect at it, but I absolutely love it. It's 10 times better than the glue. So those guys who are really struggle with false lashes, try these out, and they look good. What do you guys think? I think it looks nice. But yeah, guys, so that is the pros and cons of working in a clinic as an LPN, as a nurse in general. Rosalind Black says, yes, they look good. Thank you. Thank you. I did a little shopping, just a little bit. So how are you guys all doing during this time? They said that the health situation is getting worse, and I'm just so ready for life to go back to normal because it's just so annoying, honestly. Oh, the lashes are called, it's Ardell magnetic lashes, but it's not the double one, it's the one where you put the eyeliner. I got it on Ulta. Melody Mama 22 says Philly is about to be on lockdown again tomorrow. I know, like, New York is about to they're thinking, I think the governor is thinking about like closing schools, and I'm just like, wow. But you know, I actually really like online or learning, to be honest with you. I love online learning. For nursing school, I do love online learning. I'm not gonna lie, because if you are someone who has never done nursing, you probably may not like online nursing. But because you know I already did nursing school before, like I like online learning. All right. Melly Mama Twin says New York too. That's why I came back today. Yeah, New York is on lockdown. We got 15 people. Let's get 15 likes. Yeah. So yeah, guys. So while we're here, I just want to give you guys some news. So while I wrap up this video, for those guys who may not know, I am first generation American, and I'm going to be coming out with a separate YouTube channel that for my Haitian Creole speaking people who want to learn more about nursing, because I realize there's a lack in that. So if you guys are interested, stay tuned for when I make a video. I'm going to be talking about it. Okay. Melanin Mama 22 says, I love online school too. That's why I was hoping to start the LPN's RN program with Jersey College, and it's online for now. Yeah, I love the online school. I mean, it requires a lot of self-discipline, but I love online. Simone says, I've been doing crisis travel assignments. Oh, I was thinking about doing that. How is that, Simone? Is it good? Rosalind says, have you ever wanted to do CNA or FM? Oh, CRNA or FMP? No, I don't want to do CRNA because the school is way too expensive, and it just seems like, I'm not gonna lie, like I feel like a lot of things in life are hard, but it's just a difficulty that I do not want to go. I don't want to put people to sleep. Like I do not want that responsibility. And FMP, you know, I feel like a lot of pressure to do FMP. I'm not gonna lie. I feel like everybody and their mama doing FMP. Like FMP, FMP, FMP. I'm not saying absolutely no, but to be honest with you, I just feel like, I mean, I saw what the role of the provider is. I could always change my mind in the future, so don't quote me. But right now, at this moment, I don't feel like that's something I would want to get into, just because I feel like you're still working for someone else. Like, I just feel like you're still working for someone else. And I've spoke with doctors who like tried to open up clinics. I mean, granted, this is in New York, and it's extremely difficult right now in this climate. And I just feel like the person's still working, and there's nothing wrong with working for someone else. There's absolutely nothing wrong with that, but like just the direction, where I want to go in life is just at this moment right now, it doesn't really line up. And you know, to be a nurse practitioner, it's a lot of responsibility. You're prescribing somebody medication, like to live, like I'm saying to live, but you're prescribing somebody medication. It's a lot of work, you know. It's not a lot of everything's a lot of work, but it's a lot of responsibility. And I don't shy away from responsibility, but there's certain responsibility that you take on, and I'm just not ready for it yet. But I'm not totally opposed to it. And I heard the school, like FMP school, is hard, like just like nursing school. And like honestly, going through nursing school the second time is like, I don't know if I could do it the third time. Simone said it was cool, met a lot of nice people, did drive-through swabbing swipe. Okay. Yeah, so I might do that. I don't know. If they have that in my city. Excuse me. Yeah. So, but I feel like if you feel like you really want to do FMP, I'm not discouraging anyone from doing it or at all. I think it's a great thing to get into, but I feel like sometimes people just go for it because everybody else is going for it. And you know, I just feel like Honestly, I like school, guys, but I don't want to be in school forever. Like, it's not really, I want to enjoy my life. You know what I mean? Like, when you're in school, like, it's really hard for you to enjoy your life because your whole world is wrapped up in school, guys. Like, you don't know. Like, I gave up everything to be in school. Like, I gave up my life in Texas. I gave up my independence. Like, I gave up friends, like a social life. I gave up so much stuff, and on top of that, I went through so much, and it's just like I don't really. I'm not gonna say I don't like school. I like school. I like education, but just that brick and mortar, like just worrying about tests and schools and which teacher to get, which teacher not to get. It just seems extremely daunting and murky, honestly. But if you want to do it, like go ahead. That's what I'm saying. You have to really want to do it. Hmm. Rosalind said, "Are both your parents from Haiti?" Yes, they are. Okay. Simone says, you have to really want to be an FMP. Don't just do it because everyone else is doing it. I was a rounding nurse at the hospital and got a taste of it. Not interested in NPE either right now. Yeah, so like I said, like if you want to do it, go ahead and do it because I'm not gonna promise you that I'm always gonna have that decision. But like definitely right now, I'm like, nah. Do October says the red lipstick, love it. Thank you. I'm in FMP school. Okay, so great. We have somebody who's at FMP school. So do October. How is FMP school? Is it hard like nursing? Be honest. I bet you it is. Is it hard like nursing? This is Milani, and this is in the color 14 Devotion. It's really hard for me to find a red. It's either too dark to be red or too bright. So if you're my complexion, like I'm brown, like if you're brown or darker or even lighter, whatever. But if you're somewhere around my complexion, I do have a light as computer screen on me, be aware. But if you're like my complexion, like a brown color, then this is a really good red. It's Milani 14 Devotion. Very nice red. A ton of papers. Oh my God. Well, I don't mind writing papers. But is it hard like nursing school? Like, soul crunching hard? Like emotional roller coaster hard? Is it hard like that? I just wonder. Damn, 10 to 15 page papers. But is it hard? Oh, Do October says yes. Yeah, you see? And I don't now ever want to go through that again. Hell no. You guys have to open your eyes too. Like, if you want to do FMP, do it because you want to do it. If you're doing FMP, which I feel like a lot of people do it for because they don't want to stay in RN forever, and that's fine if you don't want to stay in RN forever. I totally get it. But look into other stuff. There's this YouTuber called Claire Realtor. You can get into real estate. Okay, you can get into business. You can get into stocks. Be careful though and do your research. You can get into consulting. There's an array of things you could get into. You get into so many things these days. But of course, do your research thoroughly. There's so much things you can do. I feel like a lot of people want to be FNP, CRNA because they are looking at the money. Let's be honest, all right? Can we be honest? Let's be honest. After dark, being honest with After Dark, okay? I'm just like one of those YouTubers who is extremely transparent like that. And I feel like a lot of people are not going to say it. Like, let's be honest. A lot of times the reason why people do those things is because they know they do not want to stay in RN forever and they want to make the money. Come on, let's Google right now. Let's Google average salary for CRNA. Average salary, damn. It is $181,040 per year, okay? Average salary for FNP. Let's see how much is that. $111,840 per year. That is a pretty impressive. That's a pretty impressive number, right? But you also have to factor in, do you have to take out loans? If you do take out loans, how long is it going to take you to finish the loans? Do you have children? Not saying that you can't do if you have children, but What about their college? Do you have a saving plan for their college? Or you could do it simultaneously. There's nothing wrong with that, but you have to think about, I feel like sometimes we gotta think, you know, we can't just jump because we hear, oh, money, let me jump. Like, no, sometimes you gotta relax and like think, like really think and say, do I want this? If you truly want it, if you truly want to be FNP because like it's your, like you have a like a wanting to do it, okay? But you have to really, really want it. You can't just do it for the money, because there are plenty of people right now. There are YouTubers right now. There's a kid who bought her mom a house just by making videos on slime. I'm not saying that you have to be a YouTuber. There are plenty of ways to make money. You just have to be resourceful, and you have to do, like, if you know how to write essays, like there's just a lot of ways. If you talk to the right people and you network, there are many ways to make money. But I'm not now when I'm saying this video, I'm not talking to the people who are FNP and who really want to do it. I'm just saying for the people who doing it because in the bottom of your heart you're doing it for the money. And I think some people are not honest with themselves. Lie to everyone else. You could lie to your mom and say, oh, I want to be FNP because of this. Or you could lie to everyone else, but do not lie to yourself. Be honest about why you want to do it. Okay? Just be completely honest about it to yourself. Because I feel like sometimes that is the thing. Okay. Rosalind said, yes, the money, LOL. Do October says, not true. NP salaries are not that much from RNs. Really? I did not know that. Do October said, travel RNs make bank. Yeah, but at the same time, travel RNs is not easy, right? Because sometimes you get into hospitals, it's just understaffed or it's hard, you know? Simone Reed says, you can make FMP and CRNA money with these crisis contacts, 6 to 10,000 weekly. Wow, that's crazy. That's good money. But that depends on like if you're RN, can you afford to take the travel contacts? Like, do you have asthma? Do you have any pre-existing conditions that would make it extremely dangerous for you to take those travel crisis pay? And will a crisis always be present? That's something else you have to keep into consideration. But for my RNs out there, like, if you are RN already and you want to do crisis pay and you feel like, you know what, you really take that risk, you take that money, you save it. Don't go buy Louis Vuitton. Don't go buy a new Mercedes Benz. You take that money and you invest it into something that will make you more money. Please. Whether it's going back to school for FMP or buying a house or buying something that will give you money, you know? Simone says, think if it's a good fit. Rosalind said, really? Simone said, I think they're talking. Okay, really? Yes, be true to yourselves. Do October says, RNs make bank. You can go to agency and get paid 40 to 55 an hour. Yup, especially in New York. Do October says, NPs can travel as well. Yeah, NPs can travel as well. So yeah, so that's just my advice. Like, of course, RNs can make the same money as NPs. I remember one time an NP on YouTube said, yeah, RNs can make the same money as NP, but NP, like, you don't work as hard to get that RN money. And that's true, you know? And, like, not everyone wants to be staff RN forever. Sometimes, you know, it's hard work to be an RN, especially in the hospital, in the med-surg unit. It could be very hard. It could be very taxing on your body, on your back, when you're lifting and turning and pushing. And come on, like, let's be honest, it could be extremely hard. So I feel like that's why some people do decide, hey, let me go back to NP school, because they want to better themselves. And there's nothing wrong with that. I always say, like, don't always be satisfied. Always want to be more. Like, you know what I mean? Like, some people say, oh, I'm just satisfied being RN. I'm not saying don't be satisfied. I'm not saying, okay, you don't have the right to be satisfied, but, like, always have another stream of income. Just try, guys. Just, I always advocate for that in my channel. Simone Siri says, a lot of nurses I worked with paid off all their debt. Wow. House? What? Then return to their regular jobs. COVID is everywhere now. Yeah. That's the thing. Like, even I'm contemplating, like, taking a little COVID crisis pay maybe. Because, yeah. I heard there are nurses, like, paying off their houses. There are nurses, paying off their houses, buying themselves a car, like doing whatever big thing, because these crisis phase, and even if there isn't a crisis, sometimes there's something called, I remember this YouTuber, I forgot her name. She made, I love her channel, but she made a video of how she made like 15,000 in 1 week or something. Strike nursing. Sometimes you go into strike nursing. Now some people may be like, well, why would you want to work strike nursing? Because they're on strike for a certain reason, and that's not right. And you know, I understand that, and I'm not like saying that is right or wrong, but sometimes if you really want to like pay off your loan or something, or you want to pay off your house, or you know, if you are in a position where you really need money, sometimes that can be an option. Our wards are always understaffed. Wow. Rosalind says, and my country pays us to go to nursing school. Rosalind, what's your country? Let me guess. Canada? Rosalind says, so they always have nurses. That's great. Simone said, I made 40K in a month. What? Oh my gosh. Man, I can't wait to become an RN. Yes, Queen Lawin. Yes, her name is Carly Ray. Yeah, that was way before the pandemic. She made that video, and I love her. She's so freaking cool. Yes, Simone is an RN. Simone Erie is an RN. Yeah. So I guess so Simone, do you have any tips for working in a crisis, like protecting yourself against that illness? Rosalind says St. Vincent and the Grenadines. Okay. Simone, you have a business. Yeah. So, wow, this conversation is very interesting. Think about that, guys. 40,000 a month. A month. Wow. Let's see. Rosalind says, you be making bag. Yes. Do October says, RNBSN. I just started agency. Yeah, the only thing about agency, I'm worried about, like, healthcare insurance, but I guess I'll figure that out. I'm loving this conversation, guys. Guys, what do you think about me starting a Facebook page, like, where we help each other, whether we're students or nurses? Do you guys like that idea? Simone Erie says, I didn't work in a hospital. I did COVID swabbing sites so far only. Oh, okay. I'm about to Google that. So Simone, did you Google like crisis COVID swabbing sites? And did you have to like get on a plane? How did that work? Rosalind says, sure, I would follow the page. Okay. The agency has insurance, costs like $50 to $100 per check. Okay. Okay. Do October, yes, they do. Okay. Ooh, it's cold now. New York is cold right now. Wow. So yeah, I feel so inspired with all this money talk. Yeah, so that's why I feel like, people should just be educated and know that you can make up to $40,000 a month as a travel RN. Think about it. I'm not saying it's going to be easy. I'm not selling you a dream here. I'm not saying it's going to be easy, but think about it. You can make $40,000. You do that. I remember when I used to do travel nursing, I met people who were there for like 6 months, 5 months, and even travel CNAs who were just there to make their coin, and they don't work for a good 6 months out of the year. So tailor your life unto your wants and needs. Be happy. Simone says, follow different nursing agencies on Facebook and travel groups. Yes, I'm in a couple of the Facebook groups. Do October says, Simone, I am with travel groups. Do Surf says, on Facebook. Yeah, I definitely think I'm going to like start a page where we can help each other, because I feel like a lot of people have great information, and like it's a shame that it's only through the lives. I feel like that's what do you guys think? I feel like I'm going to create a Facebook page, like a Facebook group, and it's going to be a closed group. It's going to be available to people who are subscribed to this channel, where I would go live, and then people can post their different links and stuff like that and help each other, whether you're a nurse, whether you're a CNA, like whoever you are, and then we can help each other that way. I think that's a really great idea. Dang, Simone says it was long hours, working 14 days straight. Wow. But hey, it's worth it. Do October, traveling prison nurses offer really good. Yep. If you're not afraid of jails. I mean, I worked in a jail. Look at my sweet face. I've worked in a jail, and if I could survive, anybody could survive. Like with jails and like correctional nursing, just treat them with respect, but don't let them like walk all over you, and you should be fine. But the biggest thing is you cannot show any fear, and don't look up what someone did and then like use that and treat someone wrong. Like, just if you cannot work with people who, like, I'm not gonna say they committed the crime, like allegedly, then. Someone said, yeah, good idea for a group. Do October says, the OT overtime in traveling is where the money is, and the stipends. Yep. Guys, you guys make me want to do travel nursing again. I feel like, guys, what do you... Okay, so now I know at this point, the only people who are going to watch are the people who really care about me. So what do you guys think? I was thinking maybe after RN, I can do travel LTC positions, because it's really hard to find travel RN positions unless I have 1 to 2 years experience, which makes absolute sense. I wouldn't want to do med surg somewhere else, another state, when I never did med surg. I know it's completely different. Do you guys think I should do travel RN as an LTC first, or should I stay in New York first and get my hospital experience here? What do you guys think I should do? And yes, I have loans to pay off. What do you guys think? Yes, Simone. I love, like, let's give it out for Simone. I love Simone Erie's YouTube channels. It's been a while since you've posted. I love her YouTube channels, her YouTube channel video. She's always posting great videos to help, like, work from home. Unfortunately, I haven't been successful in securing a work from home position, but that's okay. But I love her videos. Her videos are extremely helpful. So definitely subscribe to Simone's YouTube page. What do you guys think about that? Should I do like travel RN as a LTC, or should I just work in New York first in the hospital as a med surg? What do you guys think I should do? The thing about LTC, I feel like when you're RN, like, you're a queen. You're treated like royalty. But when you are RN in a hospital, I don't think you're treated like royalty. I'm afraid. I've heard too many horror stories. You know what I mean? Like, I feel like if you're RN, you work at LTC, you're in the queen of your castle. Well, so far, that's what I've seen. You're welcome, Simone. Rosalind says NYC. So you guys didn't answer. Should I do travel RN as an LTC or should I get my experience in the hospital? Kimmy, what is your favorite specialty in nursing? My favorite is mother, labor, and delivery, but it's extremely hard to find that position unless you know someone or something like that. Due October says experience first. Really? Oh, but I'm scared to work in a hospital. Oh, Simone, I've never done LTC. What is it like? Long-term care? I mean, it's hard as an LPN, but I think as an RN, sometimes you don't have that much work. But it could be hard. You're giving 40 patients medications, but you don't have like acute patients as you would in a hospital. Most of the LTC patients are stable, but it could be like stressful. Due October says 30 plus patients is horrible. Yeah, it is. But you get used to it. Simone says get hospital experience since you have LTC experience. I know, but I'm scared of the hospital. I'm scared they're gonna, guys, like I've been a nurse for 7 years now and I'm just afraid of like hard times. I'm not gonna lie. I'm not gonna lie. Like I don't want to be treated like crap. I'm so afraid of that. Like burnout. Like I'm already kind of like burnt out because I've been a nurse for 7 years. NYC girl says, do what makes you happy. What will you enjoy the most? Oh, thank you, NYC girl. She said, what do you see yourself in 5 years? Thank you. You're right, NYC girl. Well, I definitely want to be out of debt. I definitely want to be out of debt. That's number one. Kwan Kim says, wow, you got RN. Simone says, mercy, 40 patients, yes. It's not as bad as you think. I mean, yes, it's bad, but sometimes you only get 20 and the other nurse gets 20 and you just give medications. It's not too bad. You after a while, you just pop medications. You just give medications. You're not like administering blood and doing all those RN things. You're just giving medications as an LPN. As an RN, I'm not too sure. I think as an RN, I just see the RNs like sometimes just do paperwork or like sometimes they give medication, but I think as an RN, like you don't do as much work. It depends on the day, honestly. Simone says you'll get 6 to 8 weeks of training. I know, but will it be hell? That's the thing. After the training, after everything is done, will it be hell? Honestly, will it be hell? Hey, Kimberly Lesby, happy Sunday. How's school, girl? I hope school is going well. Kwan Kim says, I just saw you star RN program now. Your RN, I was away too long. Oh, okay, yeah. I started back in April of 2019. Mm. An RN program is not easy. No need to apologize, Kwan Kim. No need to apologize. Thank you so much for watching. Yeah. Sophie says, I start LPN in January. Sophie, my advice is buckle up your seatbelt, stay positive, be around positive people, study really hard, get your planner out, plan everything, and you can do it. Simone said, what is your ultimate goal? What specialty do you like? Honestly, I like labor and delivery. I do love labor and delivery, but at the same time, I like case management. Okay. Kwan Kim says, I was typing too fast. Sorry. Yes. Wow. Sophie says, thank you. Yeah, so NYC girl, I have a update I have a school update that I recently posted. You could check that out. Um, Kwan Kim says, "Wow, you look great. Thank you. I appreciate it. Thanks. I'm not feeling so great. I'm kind of I'm kind of a little bit under the weather. I'm sorry, guys, if my energy is not as high as it usually is. I'm a little bit feeling under the weather, but yeah." But yeah, to wrap it up, for those guys who just coming in, we were just recently talking about, you know, if you want to be a nurse practitioner or CRNA, make sure you do it because you want to do it. Because according to herzing.edu, the average salary for NP is 1,118,840 a year, and there are nurses right now making 40,000 a month. Okay, Simone recently said that. She's like, hey, she's making 40,000 a month. So what does that tell you? That tells you that make sure if you're doing NP or CRNA, you're doing it because you want to do it. Okay, yes, even if you're making 4,000 a month, you might have to work hard for your money, but you can, once you finish work hard for that money for X amount of time, you can take that money, go invest it, go make more. Okay, so like think about it like this: is every rich, how many rich people you know is a NP, or like if there's a target amount of money you would like to make per year, how many people make that and they are NP or CRNA? So don't tell me that's the only way you can reach your financial goals. Then everybody would be a FNP or CRNA, you know? Kimberly Lesby says, all is well. I took the fall term off. Okay. I go back in January. Hello everyone. Congrats on your success, pretty girl. Oh, hi Kimberly. Oh, I love let's give a shout out to Kimberly. I love Kimberly. Kimberly Lesby has been a subscriber of mine for a while now. We have the same name. Guys, you know, I would love to do a meetup, but I'm low-key scared because like sometimes I feel like 99% of people who watch like are great supporters, but you never know who watches, who I know in real life, who don't like me, or who I never met at all, who doesn't. But I'm still thinking about trying to make some kind of way for us to meet. Maybe it's through Zoom at first, and then I will slowly work up to meeting you all in person. Um, what do you guys think about workshops? Like, be honest. Would you guys go to an actual physical workshop? I would love to make like workshops and stuff. But you know, all in good timing. Let me finish with this RN first. Kwan Kim says, all right, I'm going back to school. Love you. Love you too, Kwan Kim. Good luck in school. All right, let's see what Simone says. L&D is pretty challenging to get into, I know. At the hospital where I used to work, somebody had to die. Oh no. Or retire before you had a chance to get in. Oh my God. Simone, that's so funny. I mean, my professor, my labor and delivery professor, she's in labor and delivery, so I may ask her because I have a good rapport with her. That's what I'm saying. You gotta be nice to everyone. Case management is in a good demand now. Really? So, Simone, what direction do I have to go to if I want to be a case management as a new grad RN? NYC girl says, yes, do a Zoom meetup. Zoom is a good idea. Okay. Hey, okay, I definitely want to do a Zoom meetup. But it has to be like something like, yeah, I should do a Zoom meetup. Oh, that sounds so good. Oh my God. All right. It won't be right away though, because I have to plan it. So it will probably be sometime in mid-December. Or early January. But wow, that sounds like a good idea. Zoom meetup. Because I want to make sure it's like set up really nice for you guys. Wow. All right, guys. Yes. Yes, CRM. You do have weekends off for clinic nursing. You work Monday through Friday, 9 to 5, but some days you have to stay later, depending on if the doctor has a busy schedule. Rosalind says, what do case managements do? So they basically manage a patient's case. Like if let's say a patient is a 65-year-old male with history of heart failure, the patient's in a wheelchair, like you basically manage their case, like which which doctors, providers they can go to that works in their health insurance, like their physical therapy. Like you basically manage like everyone who is an integral part of their care. You manage their case, you manage their health, so that like they're not always in the hospital 24/7. It's really good, cost effective way actually. NYC girl says, I do case management from home, but they only hire LPNs and not RNs. Got my particular role. What? NYC girl, email me, KimmyDTV@gmail.com, please. Let me know. I would love to work case management. Due October. Kimmy, you are about to go out? Nope. I put on this makeup just to make a few videos for you all and to do this live. Kisha Morris says, hey, I'm so happy I caught this live. I follow you when I was in school. Aww. I appreciate you all the time. Aww. I had the worst travel experience. No. In High Point, North Carolina. I'm afraid to travel now. Yeah, sometimes it could be hard. I'm starting urgent care next week. Wow, I never did urgent care. But wow, I'm so sorry that you had that experience. My travel nursing assignment wasn't. I had a travel nursing horror story on my channel if you want to know. I'm not gonna say my travel nursing assignment was so perfect. Like, let's be real, especially for LPN. I'm not sure about RN, but even RNs, like when you're doing travel assignment, you're either working in a facility that's understaffed because like it's just crazy, or it's a new facility so they're understaffed. So don't think that you're like, because like why would think about it like logically, why would somebody pay so much money to bring a nurse from another state to come in there? It's going to be an environment that is probably going to be challenging, so go into that mentally knowing that. So that's why they like people with experience, because they don't have time to train people and hold your hand and this is how you do that. You know what I mean? NYC girl says, I know you asked before to send your info, but I asked my boss and it's old LPNs for my particular company, so you would have to quit once you became an RN. Oh, I didn't want to waste your time. Oh, okay. Thank you, NYC girl. All right. Simone Erie says they have travel case management jobs too. Well, thank you so much, NYC girl, for asking your boss. I appreciate that. Simone Erie says they have travel case management jobs too. Yeah, but you have to have experience most of the time. Keisha Morris says, by the way, most hospitals have extensive training, at least 3 months. I know, but my thing is like, even after the training, like, will you still die? That's my thing. Will you still go home crying every day? Because like LTC stress, I understand, I know, but I don't know hospital stress, and I don't want to like I've been through a lot of stuff in the past like 3 years. I went through some personal stuff which I cannot say everything because it would require me to give out identification of people in my life, and I cannot do that because like not everybody wants their business to be broadcasted for the World Wide Web. But I've been through so much. Like, think about it. In psychology, like there's like different stresses that people go through. I moved to Texas, I moved back, I did this, I did that to get my car, like I'm in nursing school, this and that's the test, like I just, and then the health scare. Like, I've been through so much. So that's why I'm like, you know what? Why not just continue LTC? I know how to do the job very well. It's not a big learning curve. Even if it's extensive training, like, will I be happy in a hospital? Or decent? What type of nursing do you do now? I mostly do home care now. As long as I take per diem LTC, but Keisha Moore says I'm an LPN. Okay. Oh, you work in a hospital as an LPN. Wow. Yeah, that's hard to come by. CRM says you should try emergency department nursing. Oh, hell no. CRM, do you want me to die? I don't want to do, hell no. Listen, no offense to any of the emergency room nurses out there. I have a friend who actually, it's her dream to be an emergency room nurse. I'm looking at her like, I think that's why God made everybody completely different. Okay? I'm someone, I want as little stress as possible. Okay? I don't want to be stressed out saying, okay, this person, no. Emergency room nursing sounds extremely stressful. It sounds extremely taxing. It just sounds like a nightmare, to be honest with you. I'm not saying I would never do it and I can't change my mind, but emergency nursing sounds like a nightmare. It just sounds like a nightmare. I don't want to be stressed out like that. I don't want every single day my heart to be pounding. Like, I'm getting older. Maybe if it's like a 21 or 18-year-old who just graduated college, maybe, yeah, or it doesn't have to do with age, really. You could be 40, 80, 60 years old and still do emergency nursing. I think it depends on your personality. My personality is not for emergency room nursing. I do not want to die in that way. CRM said LOL. Okay. NYC girl says the same. Keisha said, what is case management like for LPN? I never did it. One time I had an opportunity to do it, but I couldn't because I'm in school. NYC girl says the same as an RN except for not doing assessment, Keisha. Yeah, so CRM said, I got you, my bad. Oh, thank you, CRM. No, it's not I hope you don't think it as an attack to you. It's not an attack to you. Thank you so much for giving me that suggestion. But, yeah, I'm just a chicken. Like, honestly, I'm just scared of emergency room nursing. Because, like, when you've been nursing for as long as I am, like, you kind of it's not a good thing all the time. But you get stuck in your ways and you get afraid to go through stuff. I'm not going to lie. Like, I'm just, like, at this point in my life, guys, like, I've been so career focused. I want to just enjoy my life, finally. I just want to just enjoy my life and move on with my life. Like, you know what I mean? Kwan Kim says, okay, I'm jail nurse, but very stressful. I'm thinking about going back to home care. I must with beautiful lady, nighty night. Oh, okay. Good night, Kwan Kim. V says, looking gorgeous. Thank you. CRM says, yeah, I know what you mean. Rosalind Black says, and settle down. Exactly. You know, like, if something you guys don't know about me is, like, I'm, like, you know, I'm still trying to decide, like, if I want to stay in New York, if I want to go to Texas, or even California. But I just feel like, you know, I feel like I want to maybe stay in New York for a while to, like, get some RN experience or something, but, you know, I'm still, like, kind of deciding. I have news. I still have, like, I'm still, like, kind of deciding. But I feel like in my life right now, it's just that, like, I reach an age where it's like, okay, I'm ready to, like, you know, settle down and stuff like that. I feel like at the end of the day, like I will get, like, what God wants for me. Because at the end of the day, we may want a lot of stuff, but God knows the best way. I've seen that so many times in my life. But, you know, I just, like, I don't want to, like, I'm just tired of being stressed out. Like, I'm tired of it. Like, I'm tired of being stressed out. I'm ready to, like, live my dreams. I'm ready to live for me. And I feel like I've worked extremely hard the past 3 years. I've been through so much. Like, I've been through the dark night of the soul this year. Well, guys, if I was to sit down and explain to you my life story, like, tears would probably be streaming down your cheeks because I've been through that much. So I'm just ready to be happy. You know what I mean? I'm ready to be happy finally. So that's why I'm just deciding, like, am I gonna be happy in New York? I'm gonna be happy in Texas. I'm gonna be happy in California. Am I gonna be happy in France? You know, I don't know, guys. It's a lot of decisions to make right now. Simone Erie, how is the crisis travel? I'm in PA. They have a lot of opportunities, but I'm not sure who or what to choose. Can you give me some tips on choosing the safest location possible? Yeah, I definitely need to make a Facebook group page. Keisha Morris says, in regards to the meds or bed bath, they are testing your judgment, boo. You can only do your job. Yeah. Keisha says she can't pass your meds. That's true. Simone Erie says, Keisha Morris, I just started. I joined a Facebook group, Travel Nurse Newbie, to get info and follow different travel agencies on Facebook and Instagram. Yeah, guys, at this point, Rosalind put that cute face. Aww. It's an emoji that goes like this. Kwan Kim says, I was going to say good night. Good night, Kwan Kim. Mwah. Keisha Moore says, can you talk about the initial investment when doing a travel assignment? Okay, so definitely have at least, okay, this is going to sound so bad, but you have to have at least some money in the bank. You have to have at least 1,000 in the bank. But let me tell you guys a little secret. You guys are like, she was so irresponsible. But my first travel assignment, I didn't have a lot of money in the bank. I'm talking probably less than $500. But the travel assignment, but a lot of times they're willing to pay for your flight. They're willing to pay for the first 2 weeks of your hotel. Of course, they're gonna take that out of your pay afterwards. So you could pretty much go. So in theory, when you want to move, if you want to do a travel nursing assignment, you could keep doing travel nursing assignment until you're ready to move. So when I started working, and then I said, okay, never mind, switch me over to the stipend thing. Don't get housing for me. And then I was able to save money that way. So that's the initial investment. You want to have but I would say at least have 2,000 in the bank. You should have way more than that, of course, but you should have at least 2,000 in the bank so that you know you could get your little. But I would say even with the initial travel time, yeah, you could have at least 2,000 in the bank, so then you could get a nice Airbnb or a nice like you get a nice little room for rent and furnish finders. Of course, do your research, guys. Be safe. Don't say KimmyDTV sent you. Be extremely safe, especially if you're a young girl. Be safe. Don't say I sent you. Be safe. But you could do a little thing like that. So make sure you got the money. Make sure you got the bread. But if you're like desperate to leave, you could do that too. But that's kind of dangerous. But just make sure you have a little bit of money, okay? Okay. Keisha Simone says, Simone, I'm sorry, Simone. It's Irie. Irie, like Jamaica Irie. Okay. Simone Irie, thank you. I will join. I need support, girl. Keisha, got you. Okay. I like how you guys are supporting each other. Simone Irie says, oh yeah, definitely have at least $1,000 in case they cancel you. Yeah. Oh Lord. You don't want to be in that. And if you have like a family member in that place, that's awesome. Keisha says, I'm typing on iPhone. I'm sorry. It's okay. What time is it now? 7:44. Simone Irie says, make sure I have get home money. Yeah. I would definitely say make sure you have get home money. At that time, like, I was just really new to it and young and stuff like that. So just like make sure you guys have some money. Because you never know. Yeah, that's extremely important. Seriously. Be safe with these travel nursing assignments. Yeah, guys. So yeah, guys, I'm really thinking about creating that Facebook page, because I see a lot of people are like, well, which travel nursing page should I join, and this and that, and everybody wants help, and I think that would be good, because like this conversation could be continued afterwards, because I haven't really eaten anything all day. I've been filming all day. Let's see. Yeah. Keisha says, I found it difficult in North Carolina because the assignment was horrible, so I left. Dang. I didn't make the money. Oh, I'm sorry. I didn't anticipate, so I was disappointed. But, excuse me, didn't want to risk losing my license. Yeah. Simone Irie said, this chat was good. Yay. So happy you enjoyed. Yeah. So, let's see in the chat, how many people have Facebook? I think I'm definitely going to try to make a Facebook page. Keisha Moore says yes. All right, guys. So, guys, please give the video a thumbs up. Thank you so much for watching. And thank you so much for the chats. I think everybody came out with something that was extremely helpful. I'm about to eat something right now. It is 7:47. Last time I ate was like, what, 12 p.m.? Ralston says, me, but I hardly log on since last night. Duty, good night. Yeah, so I would like to say good night to everybody who has been watching. Thank you so much for tuning in. I really, really appreciate you all. Mwah, mwah, mwah. Hey, Mary Green. Nice to see you too. Thank you so much for watching. So if you guys want to know the pros and cons of working in a clinic, you guys can replay this